David Ushery coming to you from our newsroom here at 30 Rock. Happy to be with you on Facebook Live talking about the coronavirus. And the most important thing we need right now is information and accurate information. So we are actually honored to have a distinguished Dean of the School of Health Sciences and Practice at New York Medical College, Dr. Robert Amler, and perhaps also significantly spent 20 plus years with the CDC. So he knows the thing about contagious diseases and getting the right information out. So doctor, we had hundreds of people kind of send questions to us and we want to address them and we're going to get to them. But I wanted to speak to you a little bit more about the news of the day because we're finding now the state level ability to test for coronavirus now is getting into place. And so we see, for example, our first confirmed case in New York City. We see other cases being ruled out in New York and Connecticut. So that's the tri-state effect for us. So the question becomes, is it spreading because we know it's contagious, or is our ability to detect and diagnose getting better so we'll see more cases, or a mix of both?
Well, David, it's obviously a little bit of both. It is spreading, as was expected, but with more testing, we're going to pick up more cases as well. And the fact that testing is more widely available is a very good thing.
How important is that? And there's still an effort to get it out to medical facilities locally.
That's right. Understand, with any new virus or disease, developing the test itself is the first technological step before antiviral medications or a vaccine. But now that we have more testing available, we can find more places where people may be getting sick and get a better picture of how the virus really does spread.
And it seems like all our government officials are trying to be consistent with that messaging. Expect that we will have more confirmed cases. Don't panic about it.
That's right, because the risk of infection is still very low. And even given infection, the risk is low because most people who get this virus so far get a mild illness, even though some will get a more severe illness and even worse.
And some of them have underlying conditions, correct?
That's correct.
All right, so let's get to the questions, because this is the thing. I think people hear headlines even on our air, and so they can't kind of juxtapose, the Louvre closing down in Paris with stay calm. So let's just go through it, you know what I mean? What are the symptoms of what we refer to as COVID-19, coronavirus? It has various names that you've kind of explained. And how do I know if I have that versus a cold or a flu?
Right. In the beginning, you won't know, because getting a cough, fever, sore throat, sneezing and fever, this could be a lot of different viruses. You don't know which you have. If you have traveled to an area that has COVID-19, you're of course going to be much more concerned, and you should be tested and investigated, and you should call your local health department or your healthcare provider and get checked out. If you've had no history of any of this at all, then you should at least do all the things that we are recommending, which is keep to yourself, cough in your sleeve, don't spread the virus to other people in your family or your coworkers, wash your hands frequently, because hands are the area where much of this gets transmitted. You cough in your hands and then you touch your face, and other people shake hands and they touch their face. So you need to really try to stop spreading whatever it is you have. And that's good advice, whether it's a common cold or the flu or the COVID-19. If you get worse, you call your healthcare provider or the health department, and they will help you investigate and possibly get tested.
Okay, so that's important. And you spent years with the CDC, and that was their initial, I think, one of their benchmarks. If you'd been to a known area where there's been an outbreak, so the travel history was important. So you identify that with yourself.
That's right.
Then we had, over the weekend, if you will, this community spread where the people didn't necessarily fit that parameter, didn't know any links to travel or any links to anyone that had it, and that changes the dynamic of what to do, right?
That's right, because the travel history was something you could really pin down. Most people know where they've been in the last 14 days.
Right.
Whether you might have passed somebody on a bus or a subway, you don't really know. But something you do know is if somebody you pass is coughing, sneezing in your face, and you do know if somebody has a fever and they're around you, you're going to be more noticing these kinds of experiences. And the CDC also has recommended for many years that you should avoid people who are coughing and sneezing. Keep a minimum distance of 6 feet if you can. We used to have a photograph, I think we still have it on file, at the CDC of a volunteer, a man who took pepper spray in his nose and sneezed. And we shot it with photography that was designed to show the droplets coming out of his face. You would not believe what it looks like. It looks like a feather plume coming out of his face. But interestingly, it tends to drop before 6 feet because the droplets are heavy and they tend to be pulled down by gravity before they get any further. Now, does this mean you're always okay if you're 6 foot 1 inch from somebody? Well, no. You obviously, it's common sense. If you could be 10 feet away, it's better. If you could be at the next subway stop, it'd be even better, right? So you try to stay away from people who are obviously sick.
Well, let me ask you that in light of what we heard today. For example, the mayor and the governor says that the person confirmed here traveled on a plane, for example. They're going to reach out to the people on the plane, though they don't think, and I'm paraphrasing, but they felt like they don't think she was particularly contagious at that time, though they don't know. Talk about that. People are wondering about flights. Many flights from the affected areas have been canceled. Talk about that risk, or people will be concerned about that.
Well, when you're on a plane, it's the same thing. If somebody is coughing and sneezing in the seat next to you, you should try to move your seat if you can, or bring it to the attention of the crew. Now, the crew already have very specific procedures to follow. They've been handed this from the FAA and I believe the CDC in terms of how to manage travelers who are sick and try to contain them from getting that infection into other people.
But this victim may not have been coughing or sneezing at that time of the flight. Is that what I was understanding them to say, perhaps?
That is always a possibility, and there isn't very much you can do to recognize that. But remember, too, we want to protect the crew and make sure they don't get infected. It's the same thing. Just like we want to protect healthcare providers once people get into the hospital.
Another anecdotal question, people said, well, okay, so she's isolated in her apartment. They say she's done everything that she's supposed to do. People wonder about air ventilation system. Is that circulating it, and what risk? Kind of separate fact or fiction from that for us. The governor and the mayor say, no, that's not a risk.
Yeah, so far it's very unlikely, and there's really no evidence that you can spread the virus that way. Is there some remote possibility that somebody could pick up a droplet in the air conditioning system? I really don't think so. And they're probably just as likely to catch the flu from their neighbor or their family member or somebody else. Once it gets down to that low a connection, you might be just as likely to catch it somewhere else. So that would not be the place to put our efforts. Getting
back to some of the questions, they came in as themes, and I think you've already touched upon it. The mayor said today, look, we're not discouraging you from going to healthcare facilities. If you feel you're sick, you should go. Try to give them the heads up so they have some things in place. But general, if people say, all right, you know what, I was in that area, or I think I might have been around someone, you want them to go to the hospital. What do you want them to do? Take them to the steps. When should I seek medical care? Where do I go? And do I tell them first?
Of course, if they're really sick, they should not wait, and they should not be thinking about getting medical care. They should go get medical care if they are really sick and they're worried about their health. If they're not sure, if they want to get some guidance, they really should either call the healthcare provider, whether it's the physician or the neighborhood health clinic, or they should call the local health department, New York City Department of Health and Mental Hygiene, to get some guidance, because this guidance will change a little bit over time, and it will also depend on what else is going on in the city or any place else around the country.
Masks. It's been brought up a lot. The companies are now trying to produce more. We did hear the Surgeon General say, look, please don't go buy the mask. We need the mask for our first responders and people on the front lines, and it may not be effective. So clarify masks for us yet again.
Yeah, Dr. Adams is the U.S. Surgeon General. He is right on point on this. The masks are absolutely essential for hospital personnel and first responders and others who have to get in the face of patients. They need protection from top to bottom, and part of that is having a good supply of masks. So we don't want them to run out. Also, they can't keep reusing the masks. They need to get fresh masks. You don't want them using a mask they had with somebody else when they're confronting you as a victim or a patient. So we need them to have fresh masks, and we can't just have everybody ordering masks just for their peace of mind, because we could run out. So,
and realistically, how
masks,
effective are they if you're just going out in the general
well,
public?
first of all, the surgical paper masks, the paper surgical masks, are not effective for the average person. They're loose around your face. They allow droplets to get around the corners and get into your mouth anyway. And they are only really designed to protect your droplets from getting on someone else.
So if you're healthy, you're
Right. So you need them in the surgical suite. You need them in the intensive care unit, the emergency room, so that a healthcare provider who's getting over a cold doesn't cough on you, the patient. But they are not particularly protective for you against getting the virus from somebody else. Now, the N95 masks are protective, but only if they're used correctly. And that really takes training and a careful fit test. Somebody like me with a full beard cannot wear an N95 mask effectively. When I was a responder during the anthrax attacks in 2002, I shaved my beard off because I wanted to be protected. So unless you're ready to shave, unless you're ready to be fit tested and have a really tight seal around your face with the mask, you're not going to be protected, and you just have a false sense of security.
Let me ask you about mass gatherings of people. This has come up on the campaign trail, for example, the political rallies. Some schools have kind of canceled anything with a threshold of either 1,000 or 5,000 people or more. Different communities respond differently, but just talk about that in general when people hear, oh, wow, maybe I shouldn't go to that concert, or maybe I shouldn't go to that. Talk about these concerns and when they hear this, or the Louvre closing down.
Yeah, well, David, there are two types of exposures that you concern yourself with in terms of your own protection. Number one is like we've talked about. Somebody who's actively coughing and sneezing, maybe has a fever, and you're saying, whoa, I don't want to get near that person.
Right.
I don't want to share droplets coming out of their mouth and nose.
Right.
I don't want that. So you're going to avoid those people no matter where you are. If you're in a large gathering and somebody standing next to you is coughing, sneezing, you're going to get away from that person. And if there's lots of people doing that, you're going to leave that gathering. It's just common sense. The other question is, what about these folks who maybe are not dramatically ill yet? Maybe they're infectious at that point, but they haven't gotten to the point where they're displaying enough symptoms that you can recognize that there's exposure. And we're going to have to watch that carefully, because up until now, we haven't seen very much of that, if at all. There have been a few cases that have been reported, but they really have not been fully investigated. So until we know for sure, just being cautious and keeping your distance from other people whenever you can makes the most sense.
So how would you evaluate?
Wearing a mask is not particularly effective.
Would you go to a particular museum or mass gathering, not in a known affected area, but something else? Would you alter your behavior at this point?
If I were really interested in that activity, I would probably go, but I still would be careful and not spend a lot of time with other people very closely. Remember, we talked about 6 feet. And the other question is to wash your hands frequently, because when you put your hands on a table or a banister in a subway station or a train station, other people have touched that. Now, if they touched it 6 weeks ago, it's probably not going to make a difference. But if they touched it 6 minutes ago, maybe it makes a difference. And it's simple enough to carry hand sanitizer, or simply to wash your hands in soap and water as often as you can, so that occasional touching that you do does not translate to touching your mouth or your face and getting germs in your face.
I was thinking that for New Yorkers, I mean, touching the pole in the subway is probably more risky, and you should wash your hands. More effective than wearing a mask in the subway, if I'm getting that correct.
You want to, washing your hands, using hand sanitizer, way more effective than wearing a mask, with one small exception, and that is if you do put on a paper mask, you'll remember not to touch your mouth because it's covered. You'll go, oops, I wasn't supposed to do that. Because most of us do touch the mouth, the nose, the eyes several times, even during an hour or two. We do touch our faces. Sorry, you didn't like that last comment.
Oh no, I didn't. No, maybe but because I've been touching it all the time. No,
it's a natural fact that people touch their faces. So you do have to work at not touching your face when you've been in a crowd. If you've been shaking hands a lot, sanitize your hands, cleanse your hands before you touch your face again.
You made me think of something fascinating. If you're just joining us on Facebook Live here with Dr. Robert Amler, who's the Dean of the School of Health Sciences and Practice at New York Medical College. He's earned that title, so I'll read every word. And also 20 years with the CDC in a prior life. The Connecticut Health Commission's first one I heard, she had a news conference with the Governor Lamont, and said, scale back on the shaking hands right now. And maybe that's a general practice that some people adhere to anyway, but I had not heard that so specifically.
Yeah, shaking hands, David, is a very basic thing. It's hard to not shake someone's hands, especially if you're meeting them for the first time, or you're in the middle of a banquet or some other gathering, you're at a family gathering. People will hug and they will kiss and so forth. It's hard to not do that, but sometimes it's good to be prudent. I think it's up to everybody to use their own common sense. Sometimes with friends or people I know, I will smile and say, maybe we just bump elbows today. And they smile and they understand. Sometimes you cannot avoid shaking someone's hand. So what I would say is use common sense, carry that hand sanitizer so that even if you can't get to soap and water, which is still preferred, by the way, you've got the hand sanitizer. You can sanitize and rub your hands, not just in the front, but in the back as well, so that you're covered.
And we realize it's been harder to find on store shelves, but nevertheless, it's still important.
By the way, hand sanitizer should be at least 60% alcohol in order to be effective.
Okay, got you. One other question we got from the hundreds that submitted, it's really about overseas travel. People hearing a lot. Obviously, some airlines have suspended flights directly to the areas affected, but also spring breaks coming up for a lot of people. They're wondering about travel overseas, period. And granted, we may be a few weeks out and things may evolve, but what do you think the people who are concerned? Do I cancel? Do I not cancel? I mean, aside from going to the directly affected areas, Do I go to Europe? Do I not go to Europe? Do I go to South America?
Exactly. Well, again, everybody's going to have their own take on this to some degree. There are very stringent travel advisories right now for some pockets of the world that have had exceptionally high numbers of cases. China, South Korea, Italy, and Japan. And even as of the moment we're talking, there could well be a couple of other countries coming online. So what you want to do is go to the CDC website, cdc.gov for gov, and just see what their current recommendations are. In some cases, they will say, don't go. In some cases, they'll say, non-essential travel, don't go. That would be for something where you just cannot get out of going. It could be something urgent for your business, for your livelihood, or for a family factor that's very compelling. But they're saying, be careful, don't go unless you really have to. And there are other countries, most of the countries, where they're saying, stay posted, be vigilant, same recommendations. If you're near people who are sneezing or coughing, that's a problem. Stay away. 6 feet. 6 feet. Wash your hands, just as if you were here in New York or some other place. It's the same basic recommendation on the presumption that most people who are infectious are going to be sick and displaying some symptoms. So, be vigilant and be careful. Keep checking and keep checking back with this news outlet so that you are fully informed of what's going on.
And you said something just before we started our live feed here about the flu shot still.
Exactly. Look, if you get sick with a respiratory disease, if you're coughing, sneezing, maybe even a mild pneumonia, at that point, do you really care what the name of the virus is? No, you just want to get better, and you'd like to avoid it if you can. Well, the most prevalent respiratory virus right now in the good old USA is flu. Even though it's not as dramatic, it doesn't have a sonorous name like COVID-19. But there's more flu right now than COVID-19. So if you're concerned about not getting that respiratory virus, get your flu shot if you haven't already done it. It's not too late to get that flu shot. And if you already got your flu shot and you are getting flu symptoms, call your doctor right away, because if it's within a defined time period, you might be able to get an anti-flu medication that will make your disease less painful, less difficult, and hopefully with a better outcome.
We think, Doctor, that people were responding to the headlines and quite frankly our reporting. cruise ships quarantine. Some deaths, rapid spread. And so now we need to provide a little context to that in terms of the mortality rate for coronavirus. Yes, there is one, but health officials seem to be saying, again, for most healthy people, it's not as much of a risk. You don't want to get it, but it's not as much of a risk as those with underlying conditions like the flu, similar to the flu.
So far, that's what we have seen, but it's difficult to predict exactly what the scope of disease will be with a particular virus until you've had enough experience to see what it can and cannot do. The fact that there have been a couple of deaths, of course, for those families, that's very tragic. It doesn't matter how few there might be.
Right.
But the fact is, so far, the risk of infection has been low, and the risk given infection has also been low.
All right. So let me just end then with I thought a good anecdote from Governor Cuomo today. He says his daughter called him last night when they heard there was a confirmed New York case. And she says, look, don't tell me not to panic. Tell me why I shouldn't panic. So, and he said the distinction wasn't lost on him. So final thought here to those who've been joining us on Facebook, context messaging to them as a veteran CDC scientist, as a dean of a medical college.
I would again say to my fellow New Yorkers, the disease risk here is low, even in places like California, Illinois, and some of the other states, Washington, that have had a lot of cases. The disease risk is still low, and the risk from flu is still greater, so do something about that if you can. You know what you can do to protect yourself, and that's what you should do. New York can handle this. We have a superb health department at the city and state level and the surrounding counties. I know these people personally, and I know that they know what they're doing. So just like police department, FDNY, we have good response capabilities, not just in New York, but throughout the country. And in general, we will rely on these folks to tell us if we need to do anything else.
Good point. And again, we reiterate that the ability to test here now on the ground is so significant. And New York City, the mayor announcing, even as recently as a couple hours ago, that they can start testing later today. So that's going to be significant. Dr. Robert Amler, thank you. You're going to be with us during our newscast as well, as I understand
That's
it.
right.
And of course, we have all the updated information at NBCNewYork.com. But we hope for those of you, and we thank you for sending in your questions, and we thank you for joining us here on Facebook and YouTube. We'll see you later on our newscast.
Thank you.